So first, kind of starting out, we can think about how poverty is prevalent and marked by numerous threats to development in terms of the child. And so when we actually think about and kind of survey from a national landscape, here's data from Kids Count and the Ann Casey Foundation kind of showing the rates of child poverty at a state level. And we can think, in the aggregate, the child poverty rate is about 18% across the nation, and there's various pockets of kind of less and more poverty. Sometimes there's pockets of state poverty that are hitting kind of up into the kind of 20-25% range, in some states where it's a little bit less in the kind of 10% range. We can drill down and kind of think about our local context and think about kind of what's happening here in Missouri. So I should also say that in this work and using these kinds of definitions, we're talking about child poverty in terms of a family of 4, 2 adults and 2 children, and a total family income of $24,000. That can change as the number of adults and kids kind of fluctuate, but there actually aren't very massive regional differences. So you can think about, this is the same kind of definition in California versus my home state of Pennsylvania. And so in many ways, this actually may be underestimating, I think, the true number of people who are living at the economic margins. But we can return back to Missouri and think about 1 in 5 children in Missouri live at or below the federal poverty line. It's about 19%. And that's at a state level. I can talk about kind of my own experiences in Pennsylvania, which has a state poverty rate of about 17%. In the aggregate, that kind of gives you a sense of things, but there are pockets of deeper poverty as you go around cities and states and parts of states. So in Pennsylvania, where I live, there are certain towns that have child poverty rates that top 50%. And so you can think about schools and school districts that are really kind of facing incredibly difficult circumstances, and the families that they're serving are incredibly kind of struggling to just make ends meet. And so we can kind of think about how prevalent this is. 20% of the populace is facing what I believe, and I will kind of show in a few seconds, are really difficult conditions. And yet, I think oftentimes from a policy perspective, we are not doing enough in that regard, even though this is a massive kind of public health issue. So the big thing to note, and I use these kind of definitions of money, but poverty is so much more than money. So I'm going to just have some illustrative data from a colleague at Cornell named Gary Evans, who did some kind of nice in-depth work kind of interviewing families, talking with kids and their parents about the kind of experiences they were having on a yearly basis. And he asked about a kind of number of adverse kind of childhood experiences, difficult things that sadly many families are going through. Things like exposure to violence, extreme kind of household noise and kind of chaos in your neighborhood, housing problems, family turmoil, family separation. He just kind of started in a really coarse way and tried to discern whether families were kind of having these kinds of experiences. And I'm going to show you kind of the percentages of this on the horizontal axis, and high versus low SES families will be coded in different colors. So in the kind of more turquoise, you'll see the low SES families, and the kind of more pink, you'll see the high SES families. And from this work, Evans and English really found that families at the margins, lower SES families, were having kind of a disproportionate number of challenges or disproportionate experience of certain kinds of challenges in their life compared to their more affluent counterparts. So kids who have lived are living kind of at the poverty line are much more likely, almost 75% will experience some kind of violence in their neighborhood, have some kind of traumatic exposure in that regard. There's common occurrences of noise, family challenges, housing issues. And for many of these kids, these are pretty impactful and difficult experiences. And you can think on the other side of the ledger, the high SES kids, many of these problems are sometimes incredibly low or near zero. We can think about housing problems about 3% of the high SES families. Obviously, there's other things that range there, but for many of these kinds of adversities, they're not really kind of seen as prevalently in these high SES families. So here we kind of see the kind of types of experiences, but we can also kind of turn this data and think about the cumulative number of these adversities. We can think about, and I'll kind of start to talk about how there may be a challenge and a cumulative toll that's taken by the experience of poverty. So what you'll see on the horizontal axis is the number of these kinds of stressors, just cumulatively summing how many of these experiences are happening to families, and you'll see the percentages on the vertical axis again with the same kind of coloring. So the high SES families are shown in this kind of salmon color. And for the most part, I'd say the preponderance of those families report 0 to 1 of these kinds of difficult adverse experiences. Turning to the low SES kids, it's much more on the 3 to 4 average amount of these stressors. So you can think about kids are being exposed to different kinds of stressors in poverty, and then they're being exposed to more kinds of stressors. And you can think about, this is trying to kind of capture, yes?
What's the one that's near number 2?
Through here? Yes, so 49% of low SES, or of high SES kids, 49% of high SES kids will experience 0 to 1 stressor, or actually they'll experience 1 stressor. So it goes from, I should say it goes from 0 to then 6 or 7 on the high end. So basically, for the most part, the preponderance of high SES kids are experiencing 0 to 1 stressful life event in the last year. Does that kind of answer your question? Perfect. So you can think about, this is still still missing aspects of the true lived experience of poverty. We can think most notably, and I think everyone kind of knows this kind of national news of just exposure to clean water. That is the kind of a current crisis in Flint, Michigan. But you can think about food deserts, the lack of kind of healthy grocery stores, or just grocery stores in general in low SES neighborhoods and environments. I was in a pretty economically marginalized town about 40 minutes south of Pittsburgh, and they were talking about how there's not a bank in town. There's not basic EMT services. So there's kind of just a plethora and a panoply of challenges that are kind of hitting low SES families that I don't even know if we could truly characterize in research, because there are so many challenges and difficulties that are often coming with this kind of context. So you can think about all of that data kind of says these things are happening. But a kind of a related question and an easy kind of follow-up question is do they matter? And so what I'll show you here is educational data, education outcome data. It's all very aggregated. It's across subjects. It's across districts. But this is from national data from some folks at Stanford Education and Public Policy. And what you'll see is on the horizontal axis is parents' aggregate socioeconomic status, so kind of the broad measure of the amount of wealth or affluence in a district. And then on the vertical axis is whether kids are at or below grade level. So it's, again, aggregating across lots of data, across lots of classrooms, but the trends are pretty striking, which is namely a massive and significant kind of positive correlation. With greater affluence, there's greater kind of on-grade kind of proficiency. And you can think about this is tens of thousands of data points and tens of thousands of districts this is getting aggregated across. But to kind of give some examples, and again to dive in a little bit to the data and some regional kind of perspectives, I think about my hometown, Pittsburgh. We kind of have about the average or pretty close to average SES. Or kind of socioeconomic indicators that were aggregated in this study, and we're a little bit below kind of the kind of national trends or where kids should be. They're about 0.7 grades behind what should be the average. We can take kind of kids in St. Louis, which is a little more economically marginalized than Pittsburgh, and again, we kind of see this kind of continued trend where kids at the margins, kids living in poverty are falling behind in grades. Obviously, this is, again, aggregating across a lot of data, but I think shows this really compelling pattern. And we could easily kind of start to pick the kind of more affluent school districts, and you'll see this kind of, those kids will be above or at or above kind of grade level pretty consistently. And so you can think this is really kind of getting at tens of thousands of kids and really showing the scope of this problem, I think, on a national level. So you can think about, this really shows you outcomes and relevance. The kind of next, I think, natural question is, well, is it really poverty? Is poverty truly the cause? I deal with this work all the time. I have my own political persuasions, but I think that everyone should kind of think about this issue and support kind of alleviating the burden of poverty for all in our society. And I think there's really compelling causal data to suggest why. So, at the broadest level, you can think about there are these third variable problems, what I would call in my work. There's a challenge of, it could always be something else. It could be some other explanation that may account for or amplify these associations. It's not that there's actually this association between academic achievement and SES. It's that maybe there's genetic differences, or you could kind of come up with some other just so story. But I wanted to share some data from some colleagues in North Carolina who I think did some powerful work that can kind of push against this kind of very simple narrative. So in brief, these two colleagues, Jane Costello and Andrea Angold, were doing what would be called a psychiatric epidemiology project in the Great Smoky Mountains of North Carolina, the western kind of part of the state, which is rural and underserved. They were doing this work that was really just focused on understanding psychiatric problems. They wanted to understand if folks who had kind of less access to care, who were maybe further out and in less populous towns, really actually had what their kind of mental health needs were. Interestingly, there was a lot of Native American, American Indian individuals in those portions of the state, and that'll be important in a second. But so they're kind of surveying just the broad rates of mental health. This project started in 1996. Well, interestingly, and kind of in a very kind of natural experiment, one kind of specific pocket of individuals living in one of these counties was able to kind of have a large economic windfall. So I said that there was a Native American reservation or Native American individuals that they were surveying. So halfway through this study, one of the tribal groups in the Great Smoky Mountains was able to get gaming rights. So they were able to open a casino on tribal land. I don't know if folks have been to the Great Smoky Mountains. It's a very beautiful place, but I think people were very drawn to the casino. It was a new and kind of exciting thing, and the casino was very, very profitable. The Cherokee tribe there then decided, given this economic windfall, that they would share it with all of the tribe members. Anyone who was affiliated with the tribe and could prove tribal heritage, regardless of whether they were currently kind of living in the area, regardless of you name it, if they were from that portion of North Carolina and had tribal heritage, they would get about a $4,000 cash payment, a portion of the proceeds of the profits every year. So what happened is that Costello and Angold were originally able to kind of survey people before the opening of the casino. And then they kind of also kind of knew how kind of the levels of poverty, the levels of psychiatric problems in these cohorts. And interestingly, because of this kind of naturalistic experiment, because of this major and massive change in people's economic circumstance, you can think about $4,000 is a 20% bump if you're at the poverty line. And so basically, they started looking at, and this basically created three groups for this experiment. There were folks who were never poor, people who were always affluent and lived in this part of Western North Carolina and had enough means to make it by. There were folks who were persistently poor, struggling and really challenged with their economic conditions. And then the kind of interesting part and related to the casino was the ex-poor. So these people began the project as living in poverty, but then because of this economic gain that was just given out, their economic circumstances changed. And so what I'll show you here is data from pre and post casino on the horizontal axis, and the number of mental health problems on the vertical axis. And I'll show each of these three groups. So kind of in keeping with some of the trends I think I already talked about, folks who were in the never poor group had the lowest level of psychiatric problems. It didn't really matter. The casino did nothing for them because they didn't get any of their money. They were fine. Nothing about their life changed. They were affluent, and they continued to be affluent. The persistently poor, again, keeping with these trends, had the highest levels of psychiatric problems. And after the casino opened, there was a modest kind of increase, but it's probably kind of about keeping in their average. But they had the highest levels. The interesting thing has become the ex-poor. So the ex-poor started with incredibly high levels or higher levels of psychopathology. But once they're given this cash payment, this $4,000 a month, their psychopathology drops. The number of mental health problems they have significantly decreases and goes back to where kind of the never poor are. And so I think this kind of really speaks to, this isn't genetics. This isn't some third variable. The only thing that changed in this specific work and this specific experiment is someone's kind of whether they had $4,000 extra that month or that year. And so it really kind of speaks to there's these causal, or at least suggestive causal evidence of how poverty can impact mental health. And if we alleviate the impact and burden of poverty, that mental health likely will prosper similarly. So that was about 25 years of child development and epidemiology research. So I'll kind of pull back for a second and give kind of a quick summary. So we can think, and just to kind of set the stage, poverty is often prevalent. accompanied by high levels of stress, both the kinds of stressors and the cumulative nature of them. It's connected to many negative outcomes. I showed you education data, but I could put in health, physical health, mental health, you kind of name it, and we'd see pretty similar what people would just say are health SES gradients, where negative outcomes are pretty consistently seen for those living at the margins at or below the poverty line. And then there's the suggestive evidence from the Great Smoky Mountains that these negative associations are really causal in nature. So if you change the economic circumstances of people, these problems alleviate. And there's other evidence that I could get into if folks have questions in the Q&A. There's some other data I can show that kind of also speak to this. So that's the kind of first thing that hopefully motivates people to think about poverty and kind of sets the stage.